Hello, I'm Neil. I'll be your nurse for today, and I'll be the one who's gonna administer your drug. So I'm just gonna apply some hand hygiene for the patient, and then provide privacy, raise the bed to my working height position, and lower the side rail on this side, on my working side. And then I'm gonna uh, do my identifiers. So I'm gonna apply hand hygiene again, and I'm I'm just gonna identify you if you're my patient. And can I get your wrist, please? Okay, good. So what's your name? Bob Square. And Mr. Square, what's your date of birth? April 19, 1940. Okay, good. Now that I have done my identifiers, um, are you allergic to anything such as medication, environment, animals, latex? No, I'm not allergic to anything. Okay, good. Now I'll be doing my initial assessment. So, Mr. Square, I'm just gonna do your vital signs. But first off, I'm gonna do your pulse. And do you prefer on which arm you'd like me to do it on? No, I don't. So I'm just gonna do it on your left arm. So I'm locating for his radial, and as I do that, I'm also looking for his respiration for 30 seconds. It's at 64 beats per minute, and it is within the normal range of 60 to 100 beats per minute, and it's +2. It's a normal. And for its respiration, it's 14 beats per minute, and it's within normal range of 12 to 20 beats per minute, and it's deep, unlabored, deep and shallow and relaxed. Okay, good. So now I'll be getting his the base of his blood pressure. So I'm just gonna put this cuff around you, and do you prefer on which arm you'd like me to do it on? No, I don't. Okay, good. So I'm just gonna put this here. Okay, so if you feel any tightness on the cuff or discomfort, just let me know and I'll stop the procedure. So now, um, until his pulse stop on his radial, I'm gonna multiply that to times 2, so it's gonna be 150. I'm gonna pump this to 150. First off, I'm gonna put on my stethoscope. So pressure is his blood pressure is 118 to 80, and it is within normal range of 120 of systole and 80 uh, diastole. Okay, now I'll be doing his temperature. Um, Mr. Square, here I have a device to get your temperature. So basically, I'm just gonna put this in your ear. It's gonna stay there for a few seconds, and if you feel any discomfort, just let me know and I'll stop. Okay, so his temperature is 37.5 degrees. Celsius, and it is within normal range of 35 to 35.5 to 38 degrees Celsius. Okay, now I'll be gathering his O2 sat. So, Mr. Square, here I have a small device. Your finger will go on it, and it doesn't hurt, but it will stay there for just a few seconds. Just let me know if you feel any pain. I'm sorry. Is 97%, and it's within normal range of 95 to 100%. So I'm just gonna write that down. I'm gonna write all that information down. Now I've done all that. Mr. Square, I'll be back. Um, if you have any questions at all, just let me know, and I'll just let me know. And the call bell here is in your right side, and we'll be there for you if you need any help. So I'm just gonna lower the bed, side roll up, and I'll be coming back. Okay, now first off, I'm gonna sign in. So last name, first name, signature, initial. I'll be putting this away. Now I have here's my doctor's order and my MAR. So again, I'm gonna do some verification. So between the two, so patient ID 12345, patient ID 12345, name Bob Square, um, sex male, date of birth April 19, 1940, April 19, 1940. Dr. Trijanki, no known RGs, no known RGs. Okay, so now I'll be verifying the drug. So cephalexin, uh, cephalexin, uh, cephalexin, 500 milligrams PO, 500 milligrams PO, every 6 hours, every 6 hours. Okay, and I'm gonna check. So I'm just gonna put the doctor's order away, and now I'll be pulling out the medication onto the med card. Okay, now we have a medication here. So I'll be doing my I'll be identifying again. So name Bob Square, patient ID 12345, sex male, April 19, 1940, Dr. Jenke, no known RGs. So I'm gonna do my 5 rights here. Um, Name of the drug, cephalexin, cephalexin, 500 milligrams, 500 milligrams, PO, every 6 hours, every 6 hours. Expiration date February 2025. It's good to go. It's not, and then I'm checking if this drug has been administered. This medication has been administered. It's not. This medication has not yet administered because there's no initial on that certain day or time. Okay, good. And so now this drug is being administered to um, Mr. Bob Square at 17th of May 2020 around 8. Okay, good. So now I'm gonna administer the drug by putting one tablet in here. So okay, so one tablet here. Then I'm gonna label it cephalexin 500 milligrams PO every 6 hours. I'm also putting the patient's name in here on the label. Okay, now that I've done that, I'm gonna do my third check again. uh, Patient ID 12345, name Bob Square, sex male, date of birth April 19, 1940, Dr. Trajunki, and then no known RGs, and the name of the drug, cephalexin, uh, then cephalexin, 500 milligrams, 500 milligrams, 500 milligrams, PO, every 6 hours, every 6 hours. Okay, good. I'm checking if I have the right dosage here. I do have the right dosage, so it's good to go. And expiration date February 2025, and this drug is being administered to Bob Square at 17th of May 2020. Okay, so again, my third check, same thing. Patient ID 12345, name Bob Square, sex male, date of birth April 19, 1940. Dr. Trijanke, no known allergies. Okay, cephalexin, 500 milligrams, 500 milligrams, 500 milligrams, PO, every 6 hours, every 6 hours, every 6 hours. Expiration date February 2025. This drug is being administered to Bob Square, and it has, however, it's not yet administered, but it's being administered at 17th of May 2020, around 8. Okay, so I'll be putting this away, and then I'll be applying hand hygiene, and I'm gonna grab everything I need. More tray. I'll be coming back to Mr. Square's room. Okay, hello, Mr. Square. I am back. So here I have my I have your medication. But before I start and tell you about this medication, I'm gonna verify you first. So first off, I'm gonna raise the bed in my working height position, side roll down, privacy, hand hygiene, And I'm gonna identify my patient again. So can I have your wrist, please? Okay. What's your name? Bob Square. Your date of birth, April 1940. Okay, good. Now that I have identified my patient, um, I'll be identifying these two. Oh, sorry. The way the way that I'm gonna identify my patient is I'll have my MAR on this hand, and then as I do that, I'm also looking um, at his armband. So, uh, so what's your name? Bob Square. Bob Square. Bob Square. Date of birth, April 1940. April 1940. Dr. Chunky. Dr. Chunky. No known RGs. No known RGs. Patient ID 12345. Patient ID 12345. Okay, good. So now I'll be uh, telling him about the drug. So, Mr. Square, so about this drug, it's called cephalexin. Basically, it fights bacteria inside your body that causes infection. And also, things that you have to know is that you have to take this every 6 hours, once a day, to make sure that you don't overdose or double dose. And also, don't share this drug to others because it's dangerous. Um, and some side effects of this drug is it causes you dizziness, abdominal pain, nausea, vomiting, diarrhea, and if you feel if you feel any if you feel any symptoms at all, just let me know. Report if you feel any symptoms or if your symptoms are getting worse. And I'm gonna make sure that this is all okay for him. Uh, are you okay with all this? For a right to refuse, you're okay with all this? Yeah, I'm okay with all this. Okay, good. So I'm gonna hand hygiene. Now I'm gonna give Mr. Square a water here. So here, the reason I'm giving him water first is because to make sure his throat is not dry when he swallow this medicine. So when he swallows it's at ease. Here you go. So then I'm gonna give the tray to him, so he can swallow the medicine. Okay, good. He'll do that by himself. Okay, good. And then I'm gonna give him water again. Chug, chug, chug. Okay, good. So, Mr. Square, if you have any questions about the medication or about all this, and if you need any help or if you feel anything, just let me know. Your call bell is here on the right side. And do you need anything else? No, no, I don't need anything else. Okay, good. So, Mr. Square, I'll be back to check on you. So, I'll be back to check on you. The call bell is in here, your right side, and if you need any help, just let us know. Okay, so I'm gonna lower the bed, side rails up, hand hygiene, open the curtains, and then right after that, I'm gonna sign my MAR on the 17th of May 2020 at 8 with my initial on it, 8. Okay, now that I've signed, I'm gonna proceed to do my documentation.